Welcome to the Practice Transition Accreditation Program Overview Part 1. Today we are going to provide you with a brief overview of the ANCC's Practice Transition Accreditation Program, including the evidence that informed the development of the credential. We will be going over the 6 domains, but not covering the specific criteria elements. When you apply to become a new applicant for PTAP, we will conduct a webinar or phone call to go over your specific questions that you may have about the program. The evidence about transition of practice programs is rich. The Institute of Medicine report on the future of nursing helped bring the necessity of transition programs for nurses to the forefront. Transition programs are focused largely on new graduates, but we must also remember that nurses transitioning between practice settings benefit from transition programs as well. Many articles state the gap in practice. Residencies and fellowships allow the nurse to transition to practice safely and effectively. A transition for nurses should be a comprehensive program that includes multiple elements like mentorship, preceptors, robust curriculums, and most importantly, outcome measures. The evidence shows there is a gap in academia to practice, and nurses need help bridging that gap so they can function as highly performing nurses. As nurses, you are probably very familiar with Patricia Benner's model from novice to expert and skill acquisition. In today's ever-changing healthcare delivery system, we need to ensure that our nurses move through her stages of development to care for our sick patients. Transition programs supporting new graduate nurses vary in length. They may be limited to a brief hospital orientation followed by a short clinical orientation to the practice setting over the period of as little as 1 to 2 weeks. Or many robust transition programs can last up to a year with a robust curriculum that help that new nurse transition. New nurses in evidence have been shown to be scared, lack confidence, need support, and they need the ability to grow into their new role. Themes expressed by advanced practice nurses include similar feelings such as being overwhelmed by responsibility, having communication challenges, needing additional support and mentorship, and they need time to adjust to their new role in healthcare setting. In the literature, there is no gold standard on what a program should exist of for nurses transitioning. The PTAP criteria is a framework that any transition program can use to create and support their current structures and processes. So what is PTAP? PTAP is a peer-reviewed accreditation program conducted by the ANCC that evaluates transition programs against a set of rigorous criteria and awards the status of accreditation. PTAP is the accreditation of a transition of practice program. This accreditation supports all programs, whether homegrown or purchased program curricula, as long as your program meets our eligibility and rigorous criteria. You can apply. What does accreditation do for you, your hospital, nursing, future employees? It compares your program to a gold standard criteria evaluating quality, something we talked about earlier. It increases your credibility. It can serve as a recruiting tool. And finally, the ANCC credential is seen as a mark of quality and excellence in the industry. The accreditation focuses on 3 types of transitions: new graduate, RN transitioning between specialty areas, and APRN transition programs. As nurses, we need time and resources to support during transitions. That is why we've developed 3 programs to address these periods in a nurse's career. The RN residency program accredits programs that transitions nurses with less than a year of experience to practice. This program must be at least 6 months in length to be eligible. The second program, our RN Fellowship program, focuses on the nurse who's transitioning between practice settings. At minimum, nurses participating in this program must have at least 6 months of experience. Our final type of program, the APRN Fellowship program, is for currently licensed APRNs who are transitioning to new practice settings. Many specialty areas have or are looking at building fellowships to help APRNs hone in on their skills in specialty areas such as the ICU, cardiology, and radiology. In the IOM report, this was the largest opportunity for growth in nursing. APRNs need time, just like our fellow nurses, to transition into the practice setting. This is a picture of our conceptual model. As you can see, we focus on Benner's novice to expert model with the domains of criteria circling the nurse. As a program needs all of these components to help facilitate a transition through the development stages. Let's take a brief look at each of the domains within the PTAP criteria. The first domain is program leadership. Within all programs, there needs to be a strong program director who has the ability to make decisions about the transition program within the practice setting. Whatever your official job title may be, the program director is a master's prepared nurse who has ultimate accountability for the transition period. The second domain, organizational enculturation, looks at how the organization welcomes and assimilates the resident or fellow into the practice setting. Even for the RN fellowship, there must be an orientation for the transitioning nurse to the new practice setting and the culture of the team they're working with. The third domain, development and design, really focuses on how the program is built and what constitutes the framework of the program, such as the goals for each nurse, competencies, and program design. This is the foundation of the program. The fourth domain, practice-based learning, embodies how the nurse is learning key elements during their transition and how they are evaluated along the way. Precepted learning in the clinical setting is essential, but equally so is the mentoring and peer support beyond the bedside. This is a time to refine clinical skills, as well as to learn how to manage stress that accompanies the transition, how to communicate effectively in the practice setting, and manage time within the nurse's new role. The fifth domain, nursing professional development, focuses on how the program encourages and promotes continued learning and growth. Some examples include how the program supports academic progression, certification, committee participation, and quality improvement projects, to name a few. The final domain focuses on quality outcomes. How does your program measure its success? What data are you collecting to showcase its impact on the nurses in your program, the patients they care for, and on the organization? Some examples of clinical outcomes include academic progression, turnover rates, return on investment, satisfaction from multiple people, such as your residents, preceptors, mentors, and management, and outcomes related to the commitment to nursing and stress, to name a few. These last few slides laid the foundation of what the ANCC is looking for in your transition program. As you can see, this is a robust program that looks at multiple layers from the program leader to the nurse's outcomes. We feel that if a program can exemplify these standards, you have met the need and call from the IOM in having a highly sophisticated transition of practice program. If you have any questions about the accreditation process, please contact us at practicetransition@ana.org and check out our website for updates. Please watch part 2 of this webinar, How to Apply for PTAP. We look forward to hearing from you and can't wait to be a part of your accreditation journey.